I'm often asked, are peptides safe? And that individual's usually looking for a simple yes or no answer. But safety in medicine almost never works that way. So instead of asking if peptides are safe or not, I'm going to walk you through how I think about risk and safety in peptides from a physician perspective, because they can be used thoughtfully and they can be used carelessly. And the difference usually comes down to context, quality, dosing, and oversight. I think about peptides like I think about the sun. We see a lot of sun in Arizona, and sun is essential for our health. It regulates our circadian rhythms, helps with the vitamin D production, boosts our mood and immune function. But too much exposure at the wrong time for the wrong individual increases harm. A person with a history of skin cancer that exposes themselves and gets a burn increases their risk of recurrence of skin cancer. That doesn't make the sun unsafe, but exposure and conditions determine the outcome. Peptides are similar. We've talked about how they're short chains of amino acids that act as signals in the body. And when you work with signals, context matters. In medicine, safety is really always about a risk versus benefit equation for each individual at their current state of health. So the better question isn't asking if peptides are safe or not. It's what risks are present for an individual, and are we managing those risks appropriately? I like to think about peptide safety using 3 variables: the state of the body receiving the signal, the intensity of the signal, and the fidelity of the signal. So let's walk through each one of those. So first, we're talking about the biologic terrain, the state of the body's health that's receiving that signal. The same peptide signal can feel supportive in one person and really destabilizing in another, depending on what's happening in that person's health underneath the surface. We look at things like inflammation load, metabolic health, their immune activation, hormone signaling, and stress physiology. All of that plays in. All of it shapes the response because peptides are signals and they don't land in a vacuum. If the terrain is strained, uneven, the response can become exaggerated, and that is not the outcome we're looking for. Second is signal intensity. That's dosing and stacking or layering of peptides. Peptides are dose-dependent signals, and with biologic signaling, more is not always better, just like with prescription meds. Too much, too quickly, layering too many peptides at once can actually overwhelm the system. And that's often when safety gets questioned, when the real issue was not safety, but signal intensity without enough capacity. The third component is signal fidelity, and we've talked about this before. This is the quality and consistency of what someone is using. Even when the peptide concept is appropriate and right for that person, quality matters, consistency matters. Variability in the purity or concentration can shift how the body responds. And in some cases, contamination or endotoxin burden can actually trigger an inflammatory or immune response that we do not want. This isn't supposed to evoke fear. It's just part of how we think about safety with any biologically active therapy. So if you're following along, peptide safety isn't a single answer. It's risk management across 3 different variables: your body, the signal intensity, and the fidelity of the signal. So what can we do to improve safety? Safety improves when risk variables are intentionally reduced or modified. That usually looks like respecting the body, not layering signals on top of instability. Using the lowest effective signal, not escalating quickly. And avoiding unnecessary stacking, especially early on in the treatment course. Reassessing constantly instead of continuously adding more. We want to simplify your regimen. And in my experience, thoughtful medicine is often quieter than aggressive medicine. And when you approach peptides this way, they become a deliberate intervention instead of a trial and error experiment. Now, I want to say something clearly. Peptides are not magic solutions, but they also aren't automatically dangerous. They are tools. And just like the sun, the goal isn't to eliminate all exposure. The goal is to use it in a way that the body can adapt to and that the body can function more optimally. So peptides When they are used with discernment in the right person at the right dose with careful oversight, can work as intended. When those pieces are ignored, though, that's when risk increases. If you remember one thing from this conversation, let it be this. Most safety concerns around peptides come from how they're used, not simply from the molecule itself. If this kind of calm, thoughtful approach to medicine resonates with you, I'm Dr. Kelly Brown. You can learn more about my practice, Ember. We're located in the East Valley. You can hop on my website and book a discovery visit and learn more about your health through the link below.